Welcome, everyone. I'm your host, Condra Smith. Today, we're discussing a panel on the recent leptospirosis outbreak in the Bahamas. Today, I have two esteemed doctors with me, Dr. Smith and Dr. Richard, who will help us understand the situation better. Let's dive right in. Dr. Smith, can you explain what leptospirosis is?
Absolutely. Thank you for having us. Leptospirosis, which is believed to be one of the most common zoonotic diseases in the world, is caused by a type of bacteria called Leptospira. These bacteria thrive in water and soil, specifically in areas contaminated by the urine of infected animals such as rodents, livestock, and even pets. It's crucial to understand that these bacteria can survive in wet environments for long periods. The bacteria thrives perfectly in tropical climates like the Bahamas. It's actively motile, meaning that it's capable of independent movement.
Mhm.
Thank you, Dr. Smith. That's very insightful. Dr. Richard, could you elaborate on how this disease is transmitted?
Definitely. As Dr. Smith mentioned, the Leptospira bacteria can live in the environment for months under proper conditions. So, what that means is the bacteria is very resilient. The bacteria can enter a mucous membrane to infect the host. Once infected, there's a 2 to 30-day incubation period, and symptoms occur 5 to 14 days after the infection. So, let's say, for example, in areas prone to flooding and heavy rainfall, remember Leptospira bacteria is capable of independent movement. Therefore, it is able to infect persons as they are in the water through a mucous membrane. That means broken skin, eyes, mouth, and nose. So, the important take from this is that leptospirosis infection is direct contact with the bacteria.
Wow, that's alarming. Dr. Smith, what are the common clinical manifestations we should be aware of?
Great question. The symptoms of leptospirosis can vary significantly. Early signs often include high fever, severe headaches, muscle aches, and chills. Some patients may also experience jaundice, abdominal pain, and in severe cases, it can lead to complications like kidney damage, liver failure, and or respiratory distress. Leptospirosis presents itself in two phases. The first being 2 to 14 days post infection, presenting itself with flu like symptoms. In this stage, detection can be done by blood testing. The second phase, which is known as the immune phase, at this point, the bacteria has settled in the kidneys. At this stage, symptoms are more severe. It is important for people to seek medical attention if they exhibit these symptoms, especially after potential exposure.
Thank you for that important information. In addition, on the call is one of my colleagues who is present with the victim of the disease.
Thanks for having me. If my story helps even one person, it's worth it. At first, I thought it was just the flu. I had symptoms of fever, chills, muscle aches. I didn't think it was anything serious. But after a couple of days, I got worse. I started having symptoms of severe headaches, vomiting, and my legs felt like they were on fire. I kept thinking I would get better on my own. Then my skin started turning yellow, and I couldn't even keep water down. That's when my sister rushed me to Princess Margaret Hospital. They ran tests and confirmed I was diagnosed with leptospirosis. I had no idea what this diagnosis meant. It turns out, after working on floodwaters after Hurricane Irene, a small cut on my leg got bacteria into it. I progressively got worse. My kidneys stopped working and my liver was inflamed. Doctors told me if I had waited any longer, I could have gone into organ failure. That really scared me. I was in the hospital for over a week on IV fluids and antibiotics. Even after getting discharged, I was weak for weeks. It took a while to feel normal again. My first thing I have to say to you guys, do not ignore do not ignore symptoms. If you feel off, see a doctor. Second, always protect yourself. Wear gloves, boots, and cover any cuts if you're working in floodwaters or near contaminated areas. And lastly, don't underestimate leptospirosis. It's not just a mild infection, it can kill you.
Thank you, Ms. Gibson, for sharing your experience with us. Dr. Richards, what preventative strategies can our viewers implement to protect themselves and their families?
Well, first, avoid areas prone to contamination, like flood zones, water sources that may have been exposed. If you're someone that works with livestock, wear protective gear. Protective gear like clothing that covers the skin, rubber boots, gloves, masks, and goggles when handling animals and their surroundings. Another preventative measure is practicing good hygiene. Good home practices like reducing rodents around the home, and this can be done by properly disposing of food waste to possibly prevent the migration of rodents in your area.
Thank you, Dr. Richards and Dr. Smith, for sharing your expertise today. It's crucial for the community to stay informed and take action. Let's work together to keep the Bahamas safe and healthy. It's been a pleasure.
Thank you for having us.